It'll just take a minute, and then I'm going to hit the record button. Okay, we're live.
Hello, everyone. Welcome.
Hi.
We're here, Kim Martino-Sexton, and I'm here with Elizabeth Lauder and Joanne Macza today, and we're going to talk about physical therapy with Joanne from Boutique Physio. So welcome, Joanne. I'm so excited to see you.
You too. Thank you so much for having me on, you guys. I appreciate it immensely.
So I'm gonna disclose a little bit here, folks, so that you know that I have been fortunate to be receiving care from Joanne. And I'll also let you know that actually my entire family has been. And so, and I have been in and out of physical therapy for the last 6-7 years. So Joanne was not my first physical therapist. I did see several for some knee injuries, a shoulder repair, and then I met Joanne a few years ago and really changed how I accessed physical therapy by working with her because of how she uniquely views the human body. And so I'm so excited to have her here today. I first met Joanne when she came down here from Chicago, right, Joanne? From Chicago to, and reached out to meet some doulas in the area to talk about working with moms and maternal, well, not just maternal health, but women's pelvic health. And so that's how I met her. And then this whole relationship has blossomed, and I'm so excited that we still have Joanne here in the area. Joanne, it feels like yesterday, but how long have you been here in St. Louis?
I've been here since 2015, and on one hand it feels like a long time, and on one hand it feels like a short time, but so much happened in that time, as you are well aware of, Kim, and the transformation in how my practice has evolved has changed immensely in growth, more than the way I view the body and the way I treat, because I've kind of treated very similar my whole entire life. But I think over the years I've had more roadblocks with insurance and everything kind of handcuffing me a little bit at times, which is the other reasons why I've kind of gotten out of the model of the insurance, just to allow me to really practice the way I think physical therapy should be practiced.
And so let's talk about that. So Joanne, tell us a little bit about what you do. So I know people have in their head kind of this idea of physical therapy. I hurt my knee, I go in, we focus on my knee because the doctor wrote me a prescription. I have 6 to 12 visits. I do these things, right? So people have that in their head, but let's talk about what you do and how that's different.
How I work when I work with a patient is I ask them a lot of questions about what their typical day feels like. And I go through it mentally in a list from how they sleep, what they feel like when they move around in bed, what they feel like when they sit on the edge of the bed, what they feel like when they get when they're in sitting, when they get in standing, when they do their first 3 steps, when they walk, when they do stairs, and then when they do their physical activity. And I really analyze it immensely because they have their list of what they can't do and they want that better. And I look at it in details to really gain some productive analysis on how do we change and what needs to be changed and what is working really well and what isn't. And so I try to really break it down to more of a practical of their day. We can all, as PTs, say that we affect function and how you sit and how you do activities, but I really kind of nitpick it and hyper analyze it. And I want it to be very drawn into what the patient is so struggling with, what they can't do, because that's what it's all about. It's, I can't sit longer than 20 minutes, or I get up in my first few steps, or I can't walk 5 miles, or I can't, bike. And so I really hyper analyze the static positions and the movements that go on, and really why. And how I look at it when I look at the body is I really look at it from a central to a peripheral. So I really look at how the spine and the pelvis is connecting to the upper body and the lower body. And I start there and then I expand out. So if you have a knee injury, for example, I look at first how the lumbar pelvic complex affects that. And then I expand out to the knee and possibly looking at the foot. And then I drag it into the upper body as necessary. And so I believe, even if I often have people that get treated for their feet and I look at their back and their pelvis first and they're kind of wondering why. And I have to remind myself to explain it to them why, because they might think that I forgot about their foot. So I really hyper analyze basically. And I think all PTs can say they do it, but I have a beautiful environment that I can do it outside of a model, which makes it a little bit easier. Plus I've had years of experience of just analyzing it to death. And I consider myself very fortunate that I can spend as much time with my patients that I can really hyper analyze it.
It is very different from how I first entered physical therapy to be working with you. You know, the first time I went to this, you know, a typical place, and there's a bunch of physical therapists and there's all these different sections, and you've got your kind of 15 minutes with the physical therapist, and then you do your exercises, and then you wrap up with your therapist, and then you go. And so, you know, coming to see you is very different because it's you I'm getting to spend the entire time with. And it is this more in-depth when you're asking me about what is really going on with me. And I feel like the other physical therapists I work with were great. They were focused on my body part and not me. And so I really appreciate how you hear me and what I'm up to and what I want and what my goals are. This last time when I started working with Joanne, I came in because of my shoulder. And so I had been to see my, the surgeon who did my other shoulder to see if I was going to need to have the shoulder done. And he was like, no, it's not a surgery issue. Let's get you some physical therapy. And I went to see Joanne, and you know, after the initial discussion, it really wasn't about my shoulder. You know, it was really about what was going on with utilizing my core and how that all played into everything. Now, I was focused on my shoulder, and then I was focused on my knee, and, you know, Joanne bringing it back to here's all the other body parts that are involved, and let's talk about function. And so I so appreciate that. And one of the other things I appreciate too is Joanne has this whiteboard in her office, and she draws out for you like your body part or your body, how things function, and you get your, you know, assignments for what you're going to work on. But really that detailed explanation of how everything is connected. And I know, you know, it's kind of like we all know that the knee bone is connected to the la bone, but the reality is that when someone draws it out for you and they're really talking about your body and how you function, it just, for me, it goes beyond just the here, do these 3 exercises. Here's why and how. Here's what you're thinking about.
And when we have that advanced or like, you know, enhanced understanding about our body, we have an ownership over being invested in helping to resolve the issue, I would think.
Yeah, and there's a very strong psychology to what is going on in your body. Call it pain, call it stiffness, call it tension. There is a psychological attachment to it. And what I'm really trying to draw on is I'm trying to reduce the fear of the psychology that's attached to it, because I think it impedes the healing and it makes you feel like you're not in control of your own body. And as Kim said, I write out things and I try to be very short and sweet and to the point. I don't like to give tons of cues because I don't think the brain can process that much, and you're already in distress, so it doesn't become useful. So I try to pick the top 2 to 3, and people have panic attacks if they think I'm going to erase off my whiteboard before they get their picture taken of it. So I really try to give my exercises, as I always tell my patients, I don't strength train my patients because I don't need to, because I think they're all strong. I really try to get them to tap into the strength that is there. And I see the core activation as this dewiring that has happened in the activation of the core that is most central to the spine. And I believe I have to just help them rewire. And when it comes to moms in particularly, that is a major shock to the brain and the body all at the same time. And I know it intimately because I experienced this myself. And that rewiring of getting your body to kind of feel like it's connected to your brain is really important in that phase. And it's important, I believe, with any injury. I don't care what the smallest. And so it's really trying to reconnect that neuromuscular connection together, so that they feel like they can attach to it. And they lose this connection. They can't describe it, but they lose it. And so an exercise to me is just an exercise, but a really specified activated exercise is a whole different entity. So I give exercises, they're very activation. I believe in a frequency over repetition model, meaning we're trying to rewire your electricity in your system. So you need it many, many, many times in the body during the day. You don't need very much of it. You just need little splashes of it throughout the day, but you need to be rewired to the point where your body system kind of takes over automatically and it starts to own it. And then your frequency of it becomes decreased. And then you become active with other things in your life.
Mm-hmm. We've got a question from somebody who's watching. Danielle asks, would physical therapy help with the beginning stages of hip dysplasia or rheumatoid arthritis, osteoarthritis, and sciatica? I have all of those things going on in my hips.
In that case, absolutely, because a lot of times, even with beginning arthritis and any kind of dysfunction that happens in that lumbar pelvic hip region, you're going to get an automatic disconnection to the core. Those stabilizers that are prime stabilizers, and when I speak of the core, it's, your multifidus, which is closest to the spine. It's your transverse abdominis, it's your pelvic floor, and it's your diaphragm. That is, to me, is the most important part of core activation. And all of those muscles will somewhat lose their integrity in being active in a patient such as herself. So they lose that connection with it because the physiology of the ailment that's going on is starting to get them to deconnect. And it becomes this very slow process, and a lot of people blame it on age. I say I don't, especially as I get older. I don't blame anything on age. I call it time. It's just time in this dysfunction starts to make this shine more and more. And then you look back and you're thinking, oh my God, I can't do things the way I did. So in her answer to her question, I say absolutely. I look at pelvic dysfunctions in cases like that, and I look at how the mechanics of the pelvis and the lumbar and the hip joint move, because I can facilitate a better connection to their core if their mechanics are working better. So I heavily use manually therapy to help reconnect them to their core so that they can then take it and run with it as well. So the answer would be yes.
I've got a question from a mom who has struggled with some leaky urine stuff. And so, during pregnancy is when it started, and then postpartum, it continued, got a little better, but it's still there for her. And, what her physician told her is that's just kind of how things are after you have a baby. And so, and I know that to be different, but I'd like you to talk about.
Yeah, I think a lot of women are convinced, or not necessarily convinced, but advised that there's this expectation is, you had a baby and you had trauma on your pelvic floor and you had XYZ associated with it, depending on the birth process. And there's this thought of, well, maybe that's just normal. And I hear this with other clients that wake up with 2 hours of stiffness in the morning at 30 years old and 50 years old and 60, and they think that's normal. I don't believe that's normal. So the idea of having some kind of incontinence issues post-birth, unless you have some real clear traumatic issues that are going on that are controlling that, and there's some strong justification, I believe there's always some change that can occur on that. So we do desensitize ourselves to it, and we do get to this point where we kind of accept it. And so I'm in the camp that I don't accept it. I'd like to change it. But I'd like to methodically go through how I change it. And I really honestly, over the years, have experienced that a lot of mothers get convinced that their pelvic floor is weak, okay? And I see it more as an incoordination. It's kind of like when I want to contract my biceps and they're already contracted. It's difficult to contract something that's already contracted. So when it is needed, it often goes into a relaxation phase. And when it's not needed, it goes into a contraction. So it becomes this incoordination. So a lot of mothers in that space, I really test the timing. So I'm very much prone to checking the timing of their contraction and relaxation and making sure their timing is on, because they're all really versed in Kegels and contracting, but they don't necessarily utilize it at the right time, and they often don't let it chill. And so if they can let it chill a little bit and download it when it should be downloaded and relax, it often can figure out when it should be contracted, and it actually becomes a better, more efficient, and more timed contraction.
That makes sense. I never thought about it that way. I appreciate that perspective. What are some of the things that that moms are likely going through, and for whatever reason their OBs or their doctors aren't catching and thinking to refer to a physical therapist, but what are some of those common things that most moms are experiencing, and kind of like this the urine leakage problem, are kind of just resigned to the belief that I just have to live with it?
I think sometimes because of how much stress has gone on in the body during the birthing process, and even before, a lot of women have pelvic dysfunctions where their pelvis just doesn't move as well, their SI joint doesn't move as well, their hip, and as a result, they kind of get left in this dysfunctional mode of movement. I kind of look at it as a car. If the framework is not really well tuned and moving, it's difficult for the tires to react well to that. You're going to feel like they're just wearing out faster. You can't use them the same way. And so with the trauma and the process of the birthing, there's a lot of force there. There's a lot of things that could go wrong in the sense of mechanics of the joint. And so I think there's less knowledge of what a physical therapist and what a manual physical therapist who has time to do these techniques can actually do to utilize to help aid them through discomfort and stiffness and return to activity and incontinence, all of the above.
It's interesting to me that we have, we grow this, when you think about pregnancy and birth and then postpartum, that, we grow this baby in our body and it takes about 9 months for not only the baby to grow, right? But for our entire body to shift, move everything around so baby can fit in there. And then we go through this amazing amount of force to get the baby out with, the most amount of softening hormones that we've ever had in our body or will have, except for during that time to allow the pelvis to separate so all the joints soften and they pull apart so that the baby can actually get out of there, right? So then baby comes out and then, those softening hormones diminish and we solidify, if you will, and then we just move on without getting checked. And it's like, wow, that was a lot to happen in our body, to have our entire pelvis pull apart and float, and then hope it all goes back exactly how it's supposed to and not get checked. And so it's like,
and I think there's the preventative care after is just kind of like an unexpected event. There's often this thought of that's not really needed. And your priority is so with something else. Your priority is like, hey, I have a baby at home and I need to sleep and I need to feed. And so you kind of lose track of that. And I think there's some importance in just that preventative checkup. And that's the other beautiful thing of the practice that I get to work in. I can do that. That's a very difficult task in a traditional physical therapy office, to have a patient come in and say, you know what? I don't really have anything major that I can say I have pain, because we all need pain with insurance claims, right?
Right.
So I don't have any pain, but I just want to get checked. That doesn't really exist in the insurance model. So I'm fortunate that my patients will come into me and they will just want me to check them, just see how things are moving, see how things are contracting, and I can do that. And I also have the beauty of they might come in and say, hey, you're treating me for my hip, but today it's like I'm feeling a little bit of something's not right here, and I can jump right in. In my model, I can do that. In other models, it's not. You get this panic attack of, oh my God, I got to do the paperwork and I got to do the filing and I got to get on the computer and I got to do this. And you lose track of what's important, which is you just want them to feel better. I want my patients to feel better. I don't see any reason why they cannot feel better.
Mm-hmm. Which is so important. And the other thing I appreciate too, Joanne, is how, so you started to talk about this just a little bit or alluded to it in terms of the emotional side of all of this work. And I've really appreciated, and I seek out care providers who, are part of my team and have an understanding of that, as I'm moving through things, because I have expressed, I have some PTSD over some of the injuries, and that causes some anxiety as I'm thinking about, even though I have goals in mind, but as I think about it, I can get stopped by it and actually maybe even feel more pain than is necessary for me to be feeling because of the anxiety. And you've been able to work with me through that. And I appreciate that that's a big part of, so I have been referring clients that I work with during pregnancy and postpartum to Joanne for the last several years, and for referring their partners, and because of that like holistic approach. And so can you talk a little more about that, like how this all plays in? Because for Elizabeth and I, this is the work we do. It's around, mental health, well-being, and the whole person.
I think I see a lot of patients that have conditions that are possibly longer than a year, and we put that in a chronic case. That's kind of how we label it. So a lot of my patients kind of are chronic, and you can look at childbirth as being chronic because it lasts longer than that overall by the time you recuperate to some degree post. And so there's always a psychology attached, okay? And in some clients, it is a major obstacle, because they are so attached to past experiences. And so I really have to walk them through and handhold them in a good way to make them understand this is important to think about. This is not important. That is not useful information. So it used to be this thought as if, well, pain is in the head. If you think I don't have pain, pain's in my head. It has absolutely nothing to do with it. It is your discomfort, whether it's pain, sharp, dull, whatever, but some is valuable and some is not. And so I truly tried to get them to understand what is valuable, what would it look like, and what would it feel like, and what is not valuable, that you can say you're doing exactly what you should do, you pat yourself on the back and you continue, because it's not useful. And if it rises up, and I kind of use a 4 below ignore scale, and when it goes up, it's telling you you need to pay attention a little bit more. So you start to categorize things, because the psychology has a major implication in how fast you can recuperate and how you get through the obstacles. And as you say, it's especially important with people that have had multiple episodes, because it becomes this traumatic experience. And if you cannot get beyond that and have some clarity with it, it really impacts your progress. That's where people's physical ailment doesn't match the psychology attached to that. And when I see those patients, I work heavily with their understanding of what is going on in their body, because I think it really allows them this speedy transition through what they're experiencing. They start to kind of own control, and there's nothing more powerful than feeling like you have a little bit more control individually for yourself. And
Absolutely.
that's where it starts to really create this cycle, this positive cycle.
What I really appreciate, and I'm reminded of talking to you this morning, is that you have this trauma-informed approach, and you understand that that your patients may have experienced some physical trauma, some a sexual assault involving parts of their body that are now experiencing pain. And what's your approach with working with women that are having some feeling unsafe even coming in for an appointment? Like how do you I know we've talked about it, and that's why I trust your practice, but if you could share, like, what's your
well, that's why,
philosophy with that?
yeah, that's why my environment is kind of set up the way it is to make it more comforting to the person. The privacy of it is a big deal because there's some insecurity over, the privacy in the environment that you're in. So being in that environment and really kind of going at the speed that the patient is allowing it to. Like if I'm doing women's health and I'm doing any kind of, external or internal evaluation or treatment, I really judge that based on the vibes I'm getting on the patient of how quick that can happen based on not what I need, it's what the patient is giving me an indication that they're just not ready. So I really kind of discuss it and kind of play it out in that manner that there is always some more traumatic experiences attached to their pain and some less. And so it will kind of guide through how you approach the treatment. And the more that I always find in the experience that, the more that I can allow them to feel like I'm not pushing something that they're not asking for, it allows them to feel like, okay, I'm comfortable. The more they're comfortable, because the art that I do, and Kim will attest to this, I talk a lot about softening and this letting go of tension in the body that aids the body to just figure itself out. It can really facilitate the body. And if you have somebody who has that experience, they aren't softening at all. And so how effective I'm going to be with any kind of skill set I can do with hands-on becomes very limiting unless they can get that softening effect. And if they have this stress, you're not going to have the softening effect to facilitate things. So it's a lot of verbal conversation. It's a lot of understanding. It's a lot of them gaining comfort with me and making sure I can facilitate that.
Yeah,
And
that you're a safe person to
Yeah.
work with them.
Yeah, exactly.
Like, yeah, a safe person in a safe space. And
Mhm.
that is, I will tell you that, the first time I went to physical therapy, it was rather intimidating to walk into, this entire place where there's 15 or 20 physical therapists and all the different slots lined up and all the different, and there's so much going on. And so, it took a lot of motivation for me to get there, just to be in that environment. And what I appreciate about Joanne's space is that it is a boutique feel. So it does, I love the name. And then I love that when I walk in, I hardly ever see another patient. Not that that's an issue if I do, but there's also lots of spaces, so there's, it just feels very different. It feels very safe. You feel very taken care of. It's very warm. It's, like you're going to a spa, not to physical therapy. And I appreciate just that, my nervous system is calm, going to do something that is not the most comfortable thing for me.
Yeah, and the environment is extremely important in setting the baseline to really, I want my patients to come in and just feel comfortable like they would in their home. And I want them to feel there's this sense of peace, because I think it has an effect on treatment. And I know that from personally, because I pick places that I go to specifically for that. And so if you can match a good clinician with a good environment, it's like a double whammy. And so to me, it's extremely important to allow you to feel kind of comfortable and at peace.
Mm-hmm. Well, some of as I was letting in the different moms groups that I get to be a part of, letting them know that we were going to be talking today, and some of the the wonderings, not necessarily questions, but just wondering, as we were having different conversations, moms will ask, and it comes up, I don't know, I want to say several times a year. Intercourse is painful.
Mm-hmm.
And I've tried to do all these different things. And I'm still having issues. And most of the time, the folks that women are talking to are OBs, and OBs are, working with women. And I love how now more and more OBs are working with physical therapists and understand that pelvic health and physical therapy is a whole discipline. And women have this, other partner besides their OB that they can work with. And so let's talk a little bit about, we share a little bit about, one, we know sex doesn't need to be painful. and how can you speak to that? What would you say to women who are like in this place where they've just been dealing with it for years?
I think that you hit the most important thing on the head, that it doesn't need to be painful. So you lose the expectation of, this is what I have. This is the way it should be. And so understanding, again, if there's not some real significant rationalization of having pain from, something very severe or significant reason, then there shouldn't be any pain. And really kind of understanding, why is the pain there? Is the pain there because there is an incoordinated pelvic floor, meaning you're contracting when you're having an insertion? So whether it's tampon or intercourse, you can have the same experience. And knowing that the timing of that contraction is not at that time, because you can imagine that would be painful. And so working with that coordination. So the expectation is, no, there shouldn't be pain, but why? And really going and analyzing those patternings and really asking the questions and being very specific about where the pain and why the pain is happening. And also the thought of understand the pelvis being a bony girdle. There are bones and joints and ligaments associated with it. So if you don't have good movement patterns through that pelvis, through the lumbar system, through the pelvis, that itself can also contribute to pain. And so in some cases, women go into pelvic floor evaluations and very OB/GYN evaluations. They're not looking at pelvic mobility, okay? Because that's not their training. They're looking at the pelvic floor as its own entity, and they might do an evaluation and they might say that, well, there's no issue at all, looks perfectly fine, but they are not looking at the mobility of the pelvis. Whereas a physical therapist, that's what we look at, and that's what I particularly look at. So that contribution to the pain can be often overlooked.
I know one of the things that stood out for me when we first met and we were talking about all of this, and you talked about mobility, and my focus is often with women during pregnancy and talking about Kegels during childbirth ed classes and strengthening of the pelvis, and something that still stands out for me is, and you mentioned it a little bit today too, is that softening, that we can be strong and soft, and that the pelvic floor can be strong, and more importantly than how strong it is can we soften it, can we release it, which is what I just heard you say again. It's like, okay, knowing when to contract and not contract, because honestly, from the time I was a little girl, and most of us, we were told to keep your legs closed and keep everything tight in there. Like you learn how to hold, so you can, you don't want to, you have to hold in your urine, you're holding everything so tight. And then here we are getting to the age of when we're, thinking about having children, or we're having intercourse, and we're still holding everything so tight that we're not connected. And so in my mind, and that's like, wow, because that's not how people talk about it, that soft is strong.
No, they absolutely do not. And I think I would hope there's more conversation about it, because when I test clients, there is this massive incoordination of timing of it. And I see it more and more and more, where that's where, sitting, for example, sitting, you technically are sitting on your pelvic floor. If you're sitting in a good position and you're sitting slightly in front of your sit bones, you're sitting on your private area. So that is a workout for your pelvic floor. So it's going to work a certain amount. So there's no need to make sitting active. To me, sitting is a passive activity. And if I make it as passive as I can, I will last longer and longer and longer, but I'm developing my good core strength. So that is an example where we get into sitting positions and we want to contract our Kegel and hold our Kegel in and hold our tummy in. That is not something that you can hang on to for long periods of time. You will not be able to. But this is where the incoordinated education happens, where our neuromuscular system starts to get confused. Like, when do you want me to work and when do you not want me to work? Because I'm just working, like, there's no coordination in the system. So then when you really don't want it, potentially with intercourse, you're like, okay, now it's still contracting and then I have pain as a result. So there's this very significant incoordination in the pelvic floor department of the core, because it is a core muscle. So the softening effect I often teach right off the bat, because I want them to understand what it feels like. And I will tell you, 99% of my patients, I tell them to soften, and they're like, their biggest look on their face is they feel nothing when they tell themselves to soften. So they've completely lost a sensation with what softening is, because they're so uploaded. So I always give them the comfort of knowing, don't worry, just tell yourself to do it and move on. Tell yourself to soften and move on. You will eventually get to a point over the days and the weeks that you'll start to feel like, oh my God, I told myself to soften and I literally feel it. They have this little epiphany, because they're just drawing in that sensation. So the softening and the unloading and the coordinating that contraction is extremely beneficial. And I think it's often overlooked.
Absolutely. I know for me, it's made a big difference. And I wasn't even aware that I was holding everything so tightly when I was sitting, and that sitting should be a passive position, because and when I think about just how we're all functioning over the last, 18 weeks here in this pandemic, and how much stress we're holding and how tight, I've been in physical therapy this entire time. So for me, I have this mindfulness around softening and, being passive when I sit, and having these conversations with Joanne that not everybody's getting the opportunity to have, but I'm much more aware that I am holding all kinds of stress, even when I'm sitting, and trying to mindfully let that go. And I'm sure I was doing it prior to the pandemic and sheltering in place and all of the stress that we're going through, but I am much more aware of it now, being something where I'm just kind of like, oh, that's right. Soften, release. I'm sitting. I'm in a position that should be comfortable, but it takes a lot. So how have you noticed, or what changes have occurred in your practice since we've been sheltering in place, Joanne?
Well, that's an interesting question. Completely the opposite of what I would thought. In the sense of the conditions that I see and the people I see, I don't think that hasn't changed, because I see a vast array of everything, but I'm busier than I've ever been, in a good way. So I'm very grateful for that. And I think I can contribute to the fact that the environment, because I work one-on-one and I have this beautiful environment to kind of have a patient at one time, and they don't feel like they're, stepping on each other at all. And so that surprised me, that I'm busier than ever before. And do I see my patients being a little bit more stressed out? I think there's always this, stress and concern of what's going on in the world. I think people are more mindful of taking care of themselves. So that could attribute to the fact that people are now seeking help for certain ailments they have. And I think the way that I treat, because I don't treat like a traditional practice, I don't treat 3 times a week and twice a week, as you clearly know, Kim. I treat typically once a week and sometimes farther than that. So this amount of time that I lengthen out and how much time I spend with my patients, it doesn't always amount to umpteen thousand visits. It's often less than that as a result, because I'm trying to teach my patients things to do. And I think in a time like this, people are thinking more preventative. They want to feel better. They're looking at different exercise sources. So this is a time of walking, biking, jogging, outdoor walking specifically, and they're trying to figure out their new exercise plan based on what they are comfortable with doing and what they aren't, in the sense of indoor. And so they're all rethinking how they're going to exercise from now on, because now we're coming into a change of season in the near future. And they're thinking, well, if I have to be indoors, what do I do? And so that probably has drawn them into taking care of certain little things that are bothering in their body. And, you know, I see that as well. So there's a few different things, but I think the big thing is my environment is conducive. The model works better in the pandemic.
Because you were already social distancing.
Exactly. I've been
so like
from day one. Now I wear a mask while I for social distance.
Mm-hmm. Yeah, and you have a great cleaning practice. I mean, I love knowing that when I'm going there, that it's the area, everything is sanitized. I know that you're cleaning everything in between. I know that, you'll wear a mask, you wear gloves, like all of the things are happening that make me feel safe, which is not, it's like wearing a mask while you're seeing people is different, but in terms of how you've kept your space, where because it's one person at a time versus 25 people in a big room with all these different things, it has always felt just more of a clean practice. Not that the other ones were dirty. I loved the physical therapy places I went to. It's not that, it's just very different feel.
Yeah, I think you're absolutely right about that. And people say that all the time to me, Kim, constantly. They literally, every time somebody comes in, they always feel, I completely feel safe here. I don't know what it is, but I just feel totally comfortable coming here. And that was from day one during the pandemic. It was always right away that everybody's like, yeah, that's fine. Everything's going on, but I still want to come see you. I'm like, that's fine, because I'm not doing anything different, except I'm being maybe more diligent with it, that they know I'm doing it, even though I was doing it all before. I'm just making them more aware that I'm doing it, as opposed to changing. And I'm, wearing a mask as I do it. And so that becomes, and, I'm fortunate because I have a lot of great people like you that know how I practice and talk about it. And I have some great physicians, some exceptional physicians that like my practice model and discuss it with their patients and make their patients feel very comfortable with, no, you will be comfortable in the environment.
Well, so what's the best way for folks to reach out and make an appointment with you?
The best way is probably on the website, where there's a link to connection, which is www.boutiquephysio.com. That's probably the easiest route. And you can go on there, you can see a lot about the practice on the website. Then it'll give you that little contact information that comes straight to my admin, who works offsite, not on-site, because she just had a baby. And so she's been offsite since day one. And the other thing about it is, if people are kind of like, she only does women's health, or she only does this, I do so many different gamuts, as Kim knows. I do Schrock therapy for scoliosis for adults and for children. I do functional dry needling. I do women's health specialty. I do taping. I literally have like thousands of hours of, I kind of pick my little tools in my toolbox based on what's needed, which gives me the advantage. And so people are looking for other people's stories. I have tons of reviews online that they can access through Yelp and Google to kind of go through other people's, and people just feel the need to want to share their story. And so I give them the opportunity to do that when they ask me. I really want other people to know about it. I'm like, just Yelp or Google and you tell your experience. I just want you to tell it in your words, what it was like. And so you can see those online as well.
And I do,
awesome.
do think it's important for people to know that it's not just moms. Our focus is moms here because of Elizabeth and I.
Yeah.
But you know, my husband and both of my sons have worked with Joanne for all different body part and all different really functional issues to really be able to move in their daily life. And that's what I love about it, is that it's your practice that really you can work with anyone. And so we appreciate that, and really appreciate you spending some time today. I know this took time away from you seeing some patients today. We appreciate that you did that so we could talk about it. And we hope everybody learned something today. I know I always do when I talk with Joanne, which is what I love about it's educational, informative, safe, and I'm getting better and healing. And so I appreciate all of that. So thanks so much, Joanne.
Thank you so much for having me. I greatly appreciate this time.
Thank you. I think our moms are really going to appreciate the info that you shared with us. We got, you know, some good questions that we got to talk about. So
thank you
it's
so
nice
much.
to see you. Take care.
Okay,
Have
bye
a
now.
great day. Thanks.
Thank you.
Bye-bye, everyone.